Good. I'm here today with Stuart, and Stuart is in from South Carolina, and you were here about 8.5 months ago.
Correct.
And you had a lot of low back pain and a lot of neck pain, and we just determined that you had some arthritis and you had some stenosis, particularly some central stenosis in your low back from a bulging disc. And we did adipose-derived stem cells. We injected into your cervical spine, into your low back. We did a transforaminal epidural. And please tell me a little bit about what your pain and function was like before the treatment, and then how you've been these last 8.5 months.
Well, there's been an accumulation of deterioration for an automobile accident that's gone on for close to 30 years. And 2 years ago, I discovered my C1 had been out that entire time. And so I was working with someone to move it back in place and keep it in place. For the last 2 years before the stem cell treatment, it kept popping out and would cause irritation and great pain. Oddly enough, in the low back. When the C1 is out, the low back is in pain. But after the stem cell treatment, my C1 has really stabilized. It has not come out of place during the past 8 months. I can feel a little bit of irritation, but just lying in my hot tub with my neck in the right curvature against the pad seems to help quite a bit, but it has not popped out of place at all since the stem cell. And in addition to that, my range of motion was severely limited on my neck. I could move just like 30 degrees without pain. I had trouble really driving an automobile and looking left and right, and the C1 would pop out if I would try to go all the way to my shoulder with my head. But now I have full range of motion from shoulder to shoulder with very little impact whatsoever. So that's also a major improvement. And my low back, I have been in pain for years. And I can say today that not every day do I have pain. And it's a huge improvement. And when you remove pain from your life just gets so much better.
That's great. That's wonderful. Well, if you had to pick a percentage improvement that you think you had overall as a result of the treatment, what would you say you've had?
Well, for overall, it's very hard to pick out a number, but it's major. It's a significant improvement. As I said, 30 degrees to 180 degrees. I mean, you can do some math and say there's a certain percentage, but it's
just the
overall,
first number that jumps in your head.
I would say it's just 80% improvement.
That's wonderful. That's wonderful. Good. I'm thrilled for you. Okay, and today we're going to do a little tune-up and see if we can get you another 20% to the end of the race.
Yes.
Super. That's great. I'm thrilled for you.